I'm on the other line with you on the phone, and I'm gonna do the update. I'm gonna link it to the Facebook.
All right.
All right. She can't hear me right now because I'm on the phone with you. So stay on the phone with me for a little bit so I can finish doing this, and then just let her know that we're talking.
Sure, sure.
Being taken care of.
All right, sure.
जी नुमान, ये डॉक्टर जवाद भी हैं इसके अंदर ऑनलाइन। तो आप दोनों अगर देख लें, कोऑर्डिनेट कर लें इस तरह। मैं आपको जवाद का नंबर भी भेज देती हूँ कि आपने अपडेट करनी है। जब हम आपको पूछें कि अच्छा आप अपडेट करें कितने हुए हैं, तो वो उसके अंदर अगर हम पोस्ट कर सकें ना स्क्रीन पे, तो लोगों को पता चल जाए।
जी ठीक है।
I'm gonna get off, and then I'm gonna come.
Yeah, sure, sure. I'm here.
So I left, and right now you.
ये मैंने आपसे शेयर कर लिया जवाद का ना व्हाट्सएप नंबर। उस पर भी आप दोनों कोऑर्डिनेट कर सकते हैं।
Yeah, sure. सो मैम, मैं अभी को होस्ट हूँ और आप होस्ट हैं। तो वो जो आप स्लाइड्स कह रही थी पीछे मूव ऑन करनी है, तो वो लेस्ली से आपने की है बात, या मैं उससे पूछूं?
मैंने की तो है, लेस्ली से बात कह रही थी कि मैं उस मेरे पास हैं बैनर्स वो जो भी लगाने के लिए। तो उसको मैं उससे जरा पूछते हैं।
जी, शी इज़ ऑन द कॉल विद मी।
लेस्ली,
Yeah.
the backs the screen share or the banner for the project, can you put that up on the background, please?
Yeah. Seeing if it stays on, just because I have to make it fit. I don't know if it's gonna look right. That's what I'm working on right now.
I see.
Yeah. Does it look weird?
Oh, I can't
Just
see anything right
putting
now.
it on. I don't know if you could see it or not, or if it looks weird.
So the people who've joined, they can't see us right now, right? Because we haven't opened the meeting.
No. No.
Can we see who has joined the meeting yet?
Yeah, I think
We have
Aisha,
nine people. Yeah.
1, 2, 3, 4, 5, 6. I can see here 6. I think the attendees one, right?
Yes, it says 9 participants.
I guess 3 are panelists and 6
Yeah.
are attendings.
Leslie, we can see the participants now. I can only see 3 names, but I see that there's 12 participants now.
मैम अगर आप ये अटेंडेंस में देखती हैं ना, वहाँ पे हैं सारे पैनलिस्ट जो हैं वो 3 हैं, जिसमें मैं हूँ, आप हैं और जवाद हैं।
अच्छा,
और
अटेंडीज का आ गया नाम। ठीक है, ओके, परफेक्ट,
अटेंडेंस में
थैंक यू।
नो।
जी, अस्सलाम वालेकुम।
Assalamualaikum.
जी, अस्सलाम वालेकुम to all the attendees and the participants. Really appreciate you all joining. We are actually starting right on time. Allah ka shukar hai. Or we are waiting for Dr. Baba Rao. He is actually in flight and he will be joining us soon. So, Bismillah Rahman Rahim. I'm Saima Zafar. I'm fortunate to be the chair of the Social Welfare and Disaster Relief Committee of APPNA. And this year we have some amazing projects at hand. Some we are about to complete, which would be the Ramadan project. And the other projects that we have outlined, I will start sharing with you, and our leaders in the project will step in and give introduction about their projects. So can you all hear me? ठीक जा रहा है इसके अंदर. Perfect. So basically, when Dr. Baba Rao will come in, he will give his comments. But our projects include, first of all, we're doing the pediatric emergency room, which will be APPNA's first flagship project in Pakistan. It will be a standalone emergency room for children in Rawalpindi, and it will be in the area of Satellite Town. The project will basically involve a partnership with Child Life Foundation, which is a well-known pediatric emergency room project that is run all over Pakistan. Our goal is to start treating 20,000 children a year. And this will save lives which have not been able to be saved in other emergency rooms because the quality of service is not that good. The pediatric emergency rooms run by Child Life has shown that previously, where the mortality of children coming to these emergency rooms was 12%, has now come down to 1.2% because they go by the guidelines and they have excellent algorithms that they use to save these children. So APPNA has stepped up, and this project is, mashallah, an amazing project. We will be working on this throughout this year. Our goal for the project is $1 million. And inshallah, we are very optimistic that we will be able to achieve that goal. Mr. Ehsan Rabbani from Child Life Foundation is working with us in making this successful. Our next project is the cornea project, and I will request Dr. Fawad Zafar to give an update from the beginning of the time that the cornea project started till to date. Thank you.
Ma'am Samek, you are muted, so can you unmute?
Yes, can you please, first of all, I'm going to allow, I think Dr. Habib Chutani would like to say a few words about Child Life Foundation. Dr. Chutani, can you please go ahead?
Hello, can you hear me?
Yes, we can hear you. Yeah.
Well, I don't know how many people are there, but it's a great privilege to talk a little bit about Child Life. I remember it was a long time ago. It was like over a decade ago when I hosted the first fundraiser in Washington, D.C. at my home for Child Life. So Ehsan Rabbani and I go way back, and they have done some amazing work in Pakistan. The data which they have shown is just like mind-boggling, right? They introduced the first pediatric ER triage program, which was not there. बच्चे अपने parents आते थे, पर्ची लेते थे, बैठ जाते थे, and if the kid is critically sick, they have to just wait for a few hours before they would be even looked at. And and in patients who are dehydrated or who have pneumonia, they have minutes to be intervened, otherwise they die. So by doing that, they have brought down their mortality rate by 90%, and that has been an amazing work which they have done. There's so many things during COVID. They have done, telemedicine and tele ER, where they were helping the smaller ERs in the country. So a lot of great things have been done by them. My daughter actually worked there and did an internship at the ER, in civil hospital for a week. And they have a good student program there, which they have already set up, where a student can go, a very structured program. They work in pharmacy, medication dispensing, direct patient contact, patient relations, all of that, where they can get a first-hand knowledge about what's going on there. So I just cannot say more good about it, right? I have 100% trust for it. I already pledged $10,000 for this program. I'm hoping that we can get this up and running and get our 1 million goal within a few months, inshallah. I think that's the main thing. I've been sending out messages to people. I think that all of us, a lot of us have already known about Child Life. So it's an easy program, easy thing to actually talk about and ask people to help and get support. So that's all I have for now. But if you have any question, I'll be happy to answer.
Thank you so much. Thank you so much. And I would now request Dr. Awais Masood, who actually went on site in Islamabad and Rawalpindi to look at this project. Dr. Masood, if you can give a few comments on that. I think you may be muted. Naman, if you can have Dr. Awais Masood, his mic turned on.
Yeah, one sec.
There he is.
Okay, can you hear me now?
Yes.
Okay, thanks. Yes, actually, unlike Dr. Chitong and Chouhani, I was not well aware of this project before. I just recently met Child Life people, Hassan, and so I was obviously very impressed. So I mean, there was very motivational meeting. So I went to Pakistan. I want to see on my own eyes that how it works. And so me and my wife, we went to their center, which they are running at PIMS, and it was amazing. Actually, I would not imagine that in Pakistan, because I worked in Pakistan in pediatrics actually during my house job. I know how low quality, low resources ER is run pediatrics wise, and it's very unfortunate that how bad is the child mortality and morbidity rate in Pakistan's even good hospitals. So I was very impressed and motivated that how good everything is, very organized, and how what they claim, it's real, that they have decreased the child mortality from 12% to 1%. So I know why and how it happened. So I went and see on my eyes. So my motivation was sky high since then. I'm working for that. And I'm glad that my alumni, Ramkana, joined that, and they did a wonderful job. I think if Atia is there, she would describe a bit more about that. So I will do whatever I can do, and I will ask everybody I knew to join this effort and raise funds.
Thank you so much, Dr. Awais Masood. I really appreciate that. As we go through our list of projects, after that, we will open up to the fundraising, and we will then bring up the matching donors that we have for our projects. And also the donors will be requested to chime in and please donate and open up your hearts, because we are very excited. This telethon, I believe, will be a turning point and will be an amazing success for all our projects. So thank you very much. Dr. Fawaz Zafar, if you can unmute your mic and talk about the Konya project, and then we'll move on to the water project. Thank you so much. Noman, if you can unmute Dr. Fawad Zafar's mic.
Yeah, sure. Yeah, done.
Dr. Fawad Zafar, if you can.
Can you hear me?
Yes.
Okay, great. Sorry about this. I had a bad connection. So thank you for giving me the opportunity to talk about the cornea project. This was started in April 2017. The first hospital we sent the corneas to was at Mayo Hospital, Lahore. And from there on, we have now spread to 41 hospitals all over Pakistan. That includes Punjab, KPK, Balochistan, and Sindh. We send corneas on a regular basis. This year, we have crossed 10,000 corneas that we have sent so far, and a total of $3,500,000 has been spent. The one place where we had to stop sending corneas was in Afghanistan. We were sending corneas to Kabul and Jalalabad, but because of the fighting, that unfortunately has stopped. We've added some new hospitals in Lahore General Hospital, Sharif Medical City. We have also added hospitals in Balochistan, including LRBT and Helpers Eye Hospital and CMH in Quetta. Now we are also going to be starting a CMH in Lahore. Each cornea costs $350, and it takes 48 hours for them to be shipped to Pakistan. I have sent 2 shipments via Turkish Airways on Saturday. They're arriving on Monday. The shipment I sent on Friday has already arrived successfully in Pakistan on Sunday. We no longer use the Middle Eastern Airlines because of the war, but Turkish Airways is still flying. And we'll be very grateful for your help. Several alumni have helped us, including Fatma Jinnah, King Edward, Bahawalpur, Nishtar, and Khyber Medical College in Peshawar. And so any help that you can give us would be awesome. Some of these patients have been blind for many, many years, 10 years, 15 years, 20 years. The cost of the cornea is $350, which is paid here in the US. There's no expense on the patient. The surgery is free, post-op care is free. So $350 can change somebody's life. Thank you so much.
Thank you very much. Really appreciate it. And inshallah ta'ala, we will continue with the fundraising for this. The next project is the Water Wells project. Dr. Abdul Majid is here to talk about it, and Dr. Aslam would like to make some comments. So, Dr. Majid, if you could kindly, Noman, if you could unmute him, and he will share his experience about the project.
Assalamu alaikum.
Ji, Assalamu alaikum.
Assalamu
Majid.
alaikum, everybody. Can everybody hear me?
Ji, we can all hear you.
Ji, thank you so much for giving me the opportunity to talk about the water project. We started this back in 2015 from Liaquat Alumni platform. And since then, mashallah, we have been going this year to year. Our first project was a 8-kilometer water pipeline in the remote area of Thar Desert rather. And from there, then we did hundreds of the manual hand pumps, dozens of the brick wells, and then we moved to the filtration plants and the solar water plants. This has served actually thousands and thousands of people along with their livestock. Some of our key APPNA leadership has visited the area, including Dr. Sajid Chaudhry, Dr. Mubashir Rana, Dr. Aslam, along with myself and Dr. Khalid Mehman, who actually has been on my side all the time. I don't have to tell anybody that how bad the situation for safe drinking water in Pakistan is. There are surveys, multiple surveys are telling us there's only 20% people has really the safe access to the safe drinking water. So it's so much need out there. Last year, we have completed a few projects, which I would like to name them now. There was a big RO plant in Chachro with 5,000 gallons capacity that we did in collaboration with Ahuat. Then we did another filtration plant, RO filtration plant in Moro, which is about the central Sindh. And we have just completed 20 units of the schools filtration units in Lahore. Couple of them, I think, was in Islamabad area, and couple of them in Gujranwala district. So we started from Tharparkar, then we moved to the Sindh area. Now we are in Punjab. Our project in progress are multiple going there. Another filtration plant near Chachro, Tharparkar. Additional school filtration units in Mirpur Khas district in Sindh. We have just released the funds to Momina Chima Foundation for 4 to 5 water units in Gilgit Baltistan. We're also working to complete one filtration plant in near Wazirabad in Gujranwala district, and one is in progress in Sindh. So we have gone for the last 10, 12 years or so with all the help from the membership and some of the people outside the membership. We have been so thankful to them and will be always, and looking for your help for this. There is so much need, nothing we can do how much the need is. We are basically conceding is we are the drop in the bucket. So whatever we can make the difference will be actually so thankful to everybody who is going to be part of this, and we request their participation. Thank you so much.
Thank you so much, Majid Bhai. I wanted to add on to this that any of the APPNA projects, whether it's a Child Life, the Cornea project, the Food Pantry project, or the Water Well project, our overhead is every penny that you donate, we get it to the project. We do not use any of these funds for any airfares or hotel stays or administrative cost like most of the charities do. So our goal is, there's recently been an analysis of the different Muslim charities, and we're very proud to say that APPNA gets every dollar to the charity that is donated from you. Dr. Aslam, I think you wanted to have a couple of comments about the Cornea project and the Water Well project, and then we'll move on to the Food Pantry project.
Hanji, Assalamu alaikum. Can you hear me?
Ji.
Yes, we can.
Thank you so much, Dr. Simon, first of all, for allowing me to say a few words. I won't take much time. And thank you, everyone, for joining for this telethon and for all the noble, causes and noble projects APPNA is doing. I think these are all worthy projects, and I can understand if somebody has more liking for one or the other project. But briefly, I want to say, as Dr. Majid was saying, that I have personally traveled with Dr. Sajid Chaudhry, our past president, and with others. And I have seen, and I have actually myself, I got involved with APPNA when one of our sister, Dr. Aisha Zafar late, was SWDR chair in 2017. And this was the one project which I got involved and got close to APPNA. And then the other project, which I'm part of it, and I know there are so many centers, or 41 centers, as Dr. Fawaz was saying. One of the centers is in Sheikh Zayed Rahim Yar Khan, and I'm from Rahim Yar Khan myself. And these two projects are very close to my heart. And I'm trying to raise, of course, its main, APPNA and me, Zafar Foundation are actually contributing towards the project. We had 26 cornea transplant done in the 30 days in December and January. Almost we're doing cornea every other day. And as Dr. Fazafar said, it costs $350. So from some of the group of Rahimia physician, I'm trying to raise $10,000 for that. And inshallah, I'm going to raise for the water project, as Dr. Majid was saying, I'm always for that. And of course, Child Life, we have done fundraising separately from APPNA, and definitely that's another, we will do definitely whatever we can do. Thank you for allowing me to say a few words.
Thank you, Dr. Aslam. Now I'd request Dr. Fiza Rafiq to talk about the APPNA Food Pantry project for North America.
Assalamu alaikum, everyone, and thank you for joining. Thank you, Dr. Saima Zafar, for giving me this opportunity to talk about food pantries, especially. As we all know that food insecurities affect many families around us, whether we live in North America, sometimes we think that everybody is having equal opportunity to get to the food. But we have witnessed there's so many families around us. They are suffering. They can be refugees, they can be new immigrants. And many people with low income, they have no jobs, unemployment, they're suffering with day-to-day groceries, and single mothers especially, they suffer a lot. So APPNA's mission of service to humanity, I think, includes not only providing many other things, but also food to families who are suffering around us. So this food pantry project is running across North America, and I'm happy to share this year Canada has joined this mission as well, and we are raising funds for food banks. We call in Canada food banks, and we're raising funds for our refugees and low-income people and new immigrants here in Canada in collaboration with APPNA Relief in Canada. So food pantries are a great project to sponsor any family around you through APPNA. And APPNA is matching your funds. Every dollar you spend, you're gonna get 50 cents sponsored by APPNA, or every $2 you spend, you're gonna get $1 matched by APPNA. So please join hands and help people around you as well in North America. Thank you.
Thank you so much. I am so grateful to the panelists for sharing their information on what has been accomplished and what is planned. And I will now open up the floor to our generous donors and our participants. I would first like to request Dr. Shala Ali, if you can be unmuted, to give her comments on the Child Life project. Rahman, if you can unmute Dr. Shala Ali.
Yeah, I have done already. I have
Okay.
done already.
Dr. Ali, if you can, I think she may be able to join. I think Dr. Shahzad Iqbal would like to make some comments. Can you turn the mic on for Dr. Shahzad Iqbal?
Yeah.
Dr. Iqbal, can you?
Yes, assalamu alaikum, everybody. Just brief comment about the two. I think all the projects with SWDRC, they're really wonderful, and I've been part of the SWDRC in the past, and I have the honor of working with the late Dr. Aisha Zafar. So I know the great work the SWDRC is doing. The two projects which are very near to my heart, one is the water project, other is the cornea project. Water project, because I have seen, Majid Bhai, his dedication, and we live in the same area, and his dedication every year and contributing and asking everybody. And second thing, the cornea project with Fawad Bhai, I think has been, we actually, when I was the chair of the of our APPNA alumni. We brought this project into our alumni as well and have seen the great work we've been doing it. So I'd like to contribute, $1,000 each for both projects. Thank you.
Thank you so much, Dr. Iqbal. Really appreciate it. Thank you for your generosity. And you've started this project with a Bismillah. So really appreciate it. We now have $10,000 for the Child Life Foundation from Dr. Habib Chotani. And we have $1,000 for the Konya Fund from Dr. Shahzad Iqbal and $1,000 for the Water Well Fund from Dr. Shahzad Iqbal. Thank you so much. I wanted to mention that our Child Life project, as I mentioned, is our flagship project for the year. So we have donation of or a volunteer for $200,000 matching if we are able to raise that from the Zafar and Meir Foundation. We had a board meeting and decided that this project is an amazing project. And so, inshallah, as funds are raised, Zafar and Meir Foundation will match dollar for dollar for $200,000, inshallah. Can we go ahead? Dr. Ali is saying that her audio is not enabled at our end. If we can have Dr. Shala Ali now.
Yeah, I have done.
Yes, can you see and hear me?
Yes,
Yeah.
we can hear you, Dr. Ali.
Okay. I don't know why my video and audio was not enabled. It seems like my video is still not enabled, but it's okay. I can talk. So I've been working with Child Life Foundation for a while, and thank you so much, Dr. Saima Zafar, that you involved me to work with APPNA. And they are doing great work in all over the Pakistan. But this project is very dear to me because it is in my home city, Rawalpindi. So I will match dollar to dollar up to for if you guys can today raise 100K, I'm going to match dollar to dollar for that. And I'm going to invite Atiya Haroon. She's a Ravilian and she's a treasury of Ramkana, and she has something to announce and she wants to donate on behalf of Ramkana. So Atiya, if you are there, can you please come and join?
Ji, Assalamu alaikum everyone. Can you hear me?
Ji, we can. Assalamu alaikum, Atiya.
This is Atiya Haroon. I'm Treasurer Ramkana EC 2026. So first of all, thank you so much, Dr. Saima, Dr. Shaila, and Dr. Avais Masood for this opportunity. So I know Dr. Avais Masood for many, many years. So when he talked about this Child Life ER project, I was very motivated, and it's very close to not only my heart, but also Ramkana. So we started raising funds for this project on Ramzan first. And within couple of days, we reached to the goal of 100K. So far we have collected 150K and it's keep going on. And that's the pledged money. And we have collected so far 110K. So we are doing great on that. And we are ready to transfer that money to Dr. Avais Masood as soon as possible.
Thank you so much. So with the 115,000 that you've raised, and inshallah, I'm sure you'll be able to get the remaining $35,000 to $150,000 from RMC. That would be wonderful. I am so grateful to RMC. They've done an amazing job in such a short period of time. It's very unusual for any alumni, and for an alumni, which is a smaller alumni, to achieve that goal is really remarkable. And hats off to you all. To Dr. Atiya and to Dr. Avais Masood and their team for making such a big difference. So we are really grateful to you. We are requesting other donors to step in and donate. We have $200,000 that we will be able to match dollar for dollar from Zafar Meir Foundation, and $100,000 that we can match dollar to dollar for Dr. Shala Ali's funds. So please step up and donate more. If anybody else would like to speak, I would be grateful. Naman, if you can unmute the mic for everybody and then people can step up and speak because it takes a little bit of time.
Yeah,
and
sure.
They can unmute on their own.
Dr. Saima, can I say something?
Ji, please go ahead.
I'm happy to share that we have started this fundraiser in Canada group as well, on WhatsApp group, as we shared the idea of sponsoring one brick for child life. for $250 and 350 Canadian dollars. And so far, I think we have raised up to $10,000 from Canada side as well, and we will continue this fundraiser until the end of Ramadan, inshallah.
That's wonderful. That's so nice of the Canadian team to do that, and Dr. Fiza Rafiq, is such a trailblazer. She's made an amazing difference in Canada for APPNA. We had started a project through the Child Life Foundation project that we're doing, that we will sell a brick for, or if you can donate a brick for $250, then that would actually get a nameplate on the wall, which will be the donor's wall at the Child Life or the pediatric emergency room. So we've been able to, attract donations from non-APPNA members, because they are able, they're excited about the fact that they can have a brick on the wall in a place where a child's life will be saved. So you can also encourage your children, whether they want to donate from their Eid, but it will make a difference. Every dollar, every penny matters. And thank you, Dr. Rafiq, for doing that.
Saima, this is Javed Suleiman.
Ji, Assalamu alaikum, Javed.
Ji, kaise hain? How are you?
Ji, great. Dr. Javed Suleiman is our past president of APPNA and was in my executive committee, and a wonderful, wonderful person and a great friend.
Thank you so much. I'm so pleased to see you spearheading this project, the Telethon. Just wanted to say a few comments over here. First of all, just like our other colleague mentioned, hats off to you all. You guys are just doing a wonderful job. And especially about this cornea project and the water project, I have been partly from the sideline, had been involved in it, and especially with the water project with Dr. Majid. He's a colleague over here in Long Island too, and I know how much passionate he is. And for the last 10 years, what he is doing. Remember the providing water to the thirsty. This is something, I think, the highest level of sadaqah, as per hadith of Huzur Akram sallallahu alaihi wasallam. So this is something very, very important, and I have supported whatever I could into that. And also, not only that, it helps in providing a basic necessity to an area where more than 70% of people live in slums, which we are talking about interior of Sindh, and further going into southern Punjab and Punjab, as well as the periphery of Karachi. So overall, it's just commendation, and very important that we continue this legacy, which was in the past Dr. Khalid Riaz, Dr. Hassan Bukhari. There are many other colleagues who were there who are no more with us over here. Then came Aisha Zafar, and she's her legacy is being continued. MashaAllah, she did so well. She was a source of inspiration for us all. At least for me, she was a wonderful source of inspiration, and let me at times of when it was a low time, I used to always talk to her and get a lot of encouragement from her in many different good projects which we have undertaken. So coming back to this point, that just continue the good work, and we, as you could call it, quote unquote, veteran of the organization, we are always there to help and support the social welfare projects. Thank you so much.
Thank you so much. Thank you for your encouragement. It means a lot to all of us. Thanks a lot.
Haji, Assalamu alaikum.
Ji, Assalamu alaikum.
This is Faz Chima. So I would like to contribute $1,000 more to Child Life Program, and I will donate through Ramkana. And I would also like to contribute $1,000 for cornea program.
Thank you so much. Thank you so much, Dr. Chima. I really appreciate it. Thank you very much for your donations. This is really taking off well, and we are so grateful to you.
Yeah, no problem.
Saima, this is Habib. I just wanted to add this, great idea of yours about that $200 for a plaque or a brick. I think that Fiza and you guys have done an amazing job in that. I think the target is, if we can get 2,000 bricks, that's $500,000. So, small donation can make a difference. So what the important part is that, yes, inshallah, we are hoping that there will be big donors, but like any donation makes a difference. So even a smallest amount, like $250 these days, when you go out with a family of 8, for example, if you go out for a dinner, you're spending more than $250 these days. Like even if you're at a good restaurant, 4 people go out, you spend that much money literally. So please think about that. It's a month of Ramadan, so I really encourage at least as many. You can reach out to your friends saying, listen, give 250 only. That's it. And we can get to 2,000 bricks. That's the target.
Thank you so much, Habib, and thank you so much for your donation of $10,000 for Child Life, which is now doubled to 20,000 because, as you know, we have the matching donation. So, mashallah, that has immediately increased to 20,000. And Allah Ta'ala says that everything you give multiplies, over 700 times. So, in Allah's house, it is multiple times. So grateful to you and grateful for your support. Really, really happy to hear that, we have such great, Dr. Churani is our board member as well. And we're so blessed to have him in our board to, support us.
Okay, Simon, let me have a few words. I'm Awais Masood. So I have been involved in Welfare Society, APPNAs, and from Ramkhana, I have been involved in many fundraising. But this fundraising for Child Life Foundation was, I would say, easiest fundraising we ever had. The reason being that credit goes to not to any individual person. I mean, I do appreciate Ramkhana's office, Ramkhana's effort, because they were very organized and they reached out to everybody. But I think the main thing was that Child Life Foundation by itself. People knew about that, and some people who did not know about that, they went to YouTube, and when they saw their videos and they saw the real work, that motivated everybody. So that shows us that how much people trust on that Child Life Foundation, their work, and how much important it is to save life of young ones. So that's the reason that people are motivated. I'm sure that people continue to be motivated, and we have our goal reached out to very quickly. Thank you.
Thank you so much.
Assalamu alaikum. This is Nadeem. Can I say something?
Dr. Nadeem Ahmed.
Ji.
Dr. Nadeem Ahmed is from St. Louis. He's a very active APPNA member and has done amazing work in his Caribbean Alumni Association. And thank you so much, Nadeem Bhai. Please do say something.
Thank you so much for giving me the opportunity. Assalamu alaikum, everybody. So Saima and late sister Aisha, I knew them for a long time. Worked with them on multiple projects. And I really was impressed by Dr. Majid's work for the clean water, and also for the cornea project. So I would like to donate $1,000 for each of those noble projects. And may Allah give us everybody barakah, especially the month of Ramadan. And we'll continue to support these projects also in the community as well. And in my alumni, I will do that also. And thank you very much.
Thank you so much, Nadeem Bhai. Very kind of you and very generous of you. Really appreciate your donation and your participation. Thanks a lot.
Assalamu alaikum, Saima. This is
Assalamu
Amra.
alaikum.
Saima, I would also like to donate to Water Project and Cornea Project. I don't want to announce the exact amount, but it will be a couple $1,000 for each.
Thank you so much, Dr. Amra Rahman. Dr. Amra Rahman is from Chicago. She's a very active member of the PPS chapter there, and is from King Edward as well. So I really appreciate you coming and participating, Dr. Ahmed. It's very kind of you.
And
Thank
then
you for your
also I
donation.
contribute towards the brick, towards the brick as well. So
Thank
all
you.
three.
Thank you. Thank you. And we will have a brass plate with your name engraved both in Urdu and English with the APPNA logo on the wall in the pediatric emergency room. So thank you very much for your donation. So it'll be $250 for that. And then the remaining you will donate for the cornea project as well as for the water well project. Thank you, Dr.
And you're not restricted to one brick only.
Yeah, yeah.
As much as you can have whole wall.
Yeah, it will be more actually. I will donate in name of all my deceased relatives. So
Thank you so much.
I'll send message to Saima.
God bless them.
And that's why I don't want to announce the amount for projects too. I will tell Saima, and it will be few $1,000s.
Thank you so much. Thank you, Amra. I really appreciate it. And inshallah, we will have the bricks. As the bricks are built, we will also post them on the website in APPNA. and create our virtual wall there. And inshallah, when the whole building is completed and the project is completed, the wall will be there as well. We have the brass plates, and it will be in the name of any loved one that you would want to dedicate it to, or to in name of your children, your family, yourself, any one of them. So we will, inshallah, we have a plan of putting up 2,000 bricks. Of course, the bigger donors, we will have pillars on the sides, and the bigger donors like the Rimkhana, their name will be on the pillars. So we are very grateful to that. And Dr. Shala Ali and
Inshallah.
Mr. Ali Sabar, their name will be on it too. Thank you.
Assalamualaikum.
Ji, Assalamu alaikum. Who's this?
This is Sophia Janjua.
जी
So, आवाज आ रही?
जी जी बिल्कुल आ रही
Ji, so thank you for spearheading the projects in SWRC. I think Ramkana has already pledged my amount to Ramkana, but my two children had donated $250 each for a brick. So both my kids have donated a brick from their income. So I wanted to share that. And I've also donated $1,000 to the Konya project.
Thank you, Dr. Jinjua. Really kind of you. And please tell both your sons that their $250 has become $500 because we have the matching donations. So inshallah, we'll have 4 bricks for them instead of 2. And I would also request all the other members, if you can talk to your children. A lot of us have our children are, now working and have grown up. My son is a resident, and he also donated. So I was very proud of that. And so all our children, mashallah, I'm very proud of Dr. Sophia Janjua's children for, making that donation. And they will have their name on this institution as well. Thank you.
And similarly, my daughter, who is a fellow, she also donated for the Childlife Foundation.
Thank you. Thank you so much. And yeah, please tell her that will be doubled, inshallah.
Sure.
Assalamualaikum. This is Nasram.
Ji Nasram, assalamu alaikum.
Assalamualaikum, Sahibaji. I'm sorry, I am traveling actually, so I couldn't join earlier. So you are doing a great job, and Dr. Masood, you are it's a very good project, the one you started, and it will help the community of Rawalpindi, that area. So from my side, I'm gonna do 1,000 and one break from each family member, like me, Kashan, and my 2 kids. So and there is one more break from Dr. Hina Ashraf. She's also with us right now. She also wants to pledge 1 break.
So that's wonderful. That will be 2,500, because if that's 1,250, we have the matching donation, and so inshallah that will be $2,500. So that is wonderful. Thank you so much, Dr. Nusram Iqbal. You did a great telethon last year, and thank you so much for your donation. We really appreciate it.
I would like to thank Dr. Nusram Iqbal. He has been so supportive for the Konya project. He's raised a lot of money, and I'm very, very grateful to him. Also wanted to share with you that Zafar Mir Foundation has been working with Child Life Foundation for several years. We helped them start the Child Life emergency at Mayo Hospital, Lahore, then at Pakistan Institute of Medical Sciences, and also in Multan. And our experience has been wonderful. The patients have been treated very well. The mortality rate has dropped significantly. And please donate as much as you can. Rawalpindi needs this facility, and we'll be grateful for all your help. Thank you so much.
Thank you, Dr. Fuad. I just want to add something here right now, is that I still continue to be working for all these projects, the one APPNA SWRC is doing it. And I'm trying to reach out to all these donors, the one who did it last year. So I'm still continue to work for your Konya project and the other projects as well, as I discussed with Dr. Saima as well last week.
I'm so grateful to you, sir. Thank you so much.
Thank you so much. Thanks a lot.
Assalamu alaikum, Saima.
Ji, assalamu alaikum, Simi. Dr.
Anji.
Simi Adrabi is an infectious disease physician, and she's a great friend. Thank you for joining.
Anji, you're doing great work. I think the pediatric ER will be such a great service to the people of Rawalpindi. And so I wanted to donate 4 bricks
Thank
for
you so
the
much.
pediatric ER. I'll let you know the names later.
Thank you. Thank you. Well, those 4 bricks will become 8 bricks, inshallah, because as I mentioned, we are matching dollar for dollar. So inshallah, that will become 8 bricks. So really appreciate you participating. Thank you so much.
Nahin, you're doing wonderful work, just like Aisha used to. You're
Thank you.
keeping up her legacy.
Thank you so much. Thank you,
Thank
Sina.
you.
जी, अस्सलाम वालेकुम, Dr. Saima and Dr. Fawad Zafar. I just want to announce that Fatma Jinnah Medical Alumni Association has raised for cornea transplants. We do it every year for the past 5 years, and we have raised less than 24 hours on Friday for 60 corneas, inshallah. And we're going to donate again this year to Zafar and Lee Foundation, and we can, if you're matching this year, let us know. Otherwise, we will donate for sure, inshallah ta'ala.
Thank you so much, Dr. Salwa. That's so kind of you, so generous. MashaAllah, your donations come every year, and we've been able to help patients at Sir Gangaram Hospital. We have again restarted, and the first shipment is arriving tomorrow. And inshallah ta'ala, I'll keep you updated. बहुत मेहरबानी आपकी, बहुत शुक्रिया.
बहुत शुक्रिया जी, thank you.
Gee, FG Alumni is doing a great job. They sponsor their students. They put them up in their homes. They, there's such a great success stories of, young physicians succeeding from their alumni because of support from the FG alumni. And then they supported us tremendously in the Ramzan Food Project and now, in the Cornea Project. So thank you so much.
Sama, can I speak?
Ji, Dr. Ali.
Yes, I want to talk about the Cornea project. Fawad Bhai always sends a video of the people who are being unable to see again, people who have lost their vision, and because of this Cornea project, they regain their vision. And it was very emotional to see some kids who were able to see their parents again. So I want to donate $5,000 to the Cornea project, and I also want to appreciate Dr. Fawad for his work. Thank you so much for sending those emotional videos. The people who are praying, it's always so good to see that they bring tears in my eyes every time I see a story. And there are so many stories. This tells me that it's not just a number. These are real people, especially children who are able to see their parents again. Every child should be able to see their parents. So thank you so much. And we often make fun of Fawad Bhai that no matter it's war or any situation, the world is worried about that. But Fawad Bhai is always worried about his corneas, that how the corneas will reach Pakistan. So thank you so much for this great work that you have been doing.
I'm so grateful to you, Dr. Shala. That is so kind of you. This really makes me very emotional. Thank you. बहुत शुक्रिया.
I shared with him that, the flights, different flights from Middle Eastern Airlines to Pakistan or to any other country are currently, not going. And he said, "Oh my goodness, what about my corneas?" So his focus is always on the corneas. So
we witnessed his passion. Like he always sends us message. Oh, Gangaram mein abhi nahi ja rahe hain aapke cornea. 5 corneas per month. They have to go to Gangaram every month. So he's very passionate, and our alumni is also very passionate. Like whenever we start raising funds for corneas, people just donate. Like and with less than 24 hours, we raised 22,000, mashallah, for cornea.
MashaAllah.
This is just because you send us all those videos, as Dr. Shala said. They're heart touching when we see that people who could not see, they can see now. So it's it touches our hearts, mashallah. So thank you for doing this great work.
Thank you, Ji. Thank you so much.
Assalamu alaikum.
Ji, assalamu alaikum, Dr. Zishan. Dr. Zishan is from Nishtar. He's our board member. Thank you so much for joining.
Ji, thank you so much. First of all, especially today when it's International Women's Day. So we're here celebrating, the incredible strength of, women in different roles. And I think one of the most powerful way to honor this day is supporting mother and children and for child care. So I would like to donate $1,000, $250 from each of our family member. And thank you again for doing this, and so grateful to be part of it. Thank you.
Thank you, Dr. Zishan. So $1,000 will go to 2,000. We really appreciate that. And your joining, it means a lot to us. You're the youngest board member, and we have tremendous hopes for you for future of APPNA. Thank you.
And he's a Jersey boy.
He's a Jersey boy.
Saima, this is Rizwan. Can I
Can I have a moment?
Ji, please, Dr. Rizwan Khalid, this past president of APPNA, and he's a Dallas resident as well. Thank you so much for joining.
जी बहुत बहुत शुक्रिया जी. First of all, thank you very much for all of the people that have put in really a lot of hard work in all of this. एक चीज़ जो सबसे important होती है, we look at के lead कौन कर रहा है, who is leading the project. Unfortunately, जब fortunately when we trust the leaders, then it becomes really really very easy to support the project. I did not know much about the Child Life Foundation. I was educated by Habib and Habib Chutani and Saima. But what I know was I trusted Saima. I trusted that when Saima picks up a project, it's done with due diligence. And, so inshallah ta'ala, Saima, we will, Khalid family has already sent the check for $10,000. And it, inshallah ta'ala, I think it should be at the APPNA office by Monday. And we did not want to pay the 2.5 or 3% fees, the credit card fees. We want even that money to go into this particular endeavor. The other thing that, Saima, I think it's very important for all the listeners to understand is that our administrative costs are minimal. Yes, there may be administrative cost at the ground level with Child Life Foundation, but APPNA itself as a vessel has negligible administrative charges, and this is one of the things that when we're very proud of, and we compare ourselves to many of the other charities, Muslim charities, that we do it with minimal administrative charges, and whatever you donate to upper, a significant amount goes to the ground to people that actually need it. Again, really appreciate all the work that you are doing, Fuad Bhai, and all the team. So Jazakallah.
Saima, sorry to interrupt. Baba just called me that he need to be unmuted so he could join.
Numan, can you please unmute Dr. Baba Rao?
Yeah, sure. Sorry, one sec. I can't see Dr. Baba Rao.
Ji, Saima, Assalamu alaikum. Babar here when I get a chance.
Ji, Assalamu alaikum. Please, Dr. Rao, we've been anxiously waiting for you. The leader of the pack.
No, I'm just happy that your team is doing this wonderful job. And obviously, we are working on more donations, you know that, but Awais is leader of our donations. But I'm really, really thankful to you, Sajid Awais, and rest of your team. And obviously, all the projects are important to us, small to large, starting from water projects to cornea projects to now child life projects. And I will do my best to make sure that all of these we complete as much as we can. So I'll let you continue, and any questions, I'll take it later. Thank you.
Thank you so much.
Thank you.
We have, we've mentioned
Can I
the
ask a
matching
favor?
donations. Ji, please.
I'm sorry to interrupt you. Dr. Naeem Saab is wanting to join. He would like to make a donation. He says he's not been unmuted.
Numan, can you please unmute Dr. Naeem?
And Dr. Zafar, this is Nauman Ashraf. Can I say something?
Ji, please
Yes,
go
sir,
ahead.
go ahead.
And then after that, please unmute Dr. Naeem. Thank you. Ji, Doctor.
Assalamu alaikum. So, as the president of Liaquat, I would like to make the donation from Liaquat for the clean water. We are still doing our campaign, but we have pledges for about 17,350 for the clean water project. So my donation of $1,000 is part of that. But for other projects, I would like to also donate 4 bricks for the child life, and then 500 for the cornea project, and then 500 for the Hassan Suleiman. So
thank you so much.
Thank you so
much. We'll definitely let them know. So your bricks for the Child Life Foundation will be doubled, inshallah, with the matching funds. But Dr. Numan Ashraf, thank you so much, and I really appreciate the efforts of Liaquat alumni. Your Dr. Majid has been such an amazing member of our committee and member of the organization. We really look up to him as our older brother. And of course, you being his team member have done amazing in joining. So, your alumni continues to do great work. Thank you so much.
Thank you.
Dr. Naeem, if you can join.
Sama, he's logged out. He says he's going to log back in very shortly.
Okay, all right. In the meantime, we'll take another caller.
Rakum Simon, Mushtaba speaking.
Ji, Dr. Kazi, thank you so much. Dr. Mushtaba Kazi is our board member, and he's an ophthalmologist and has been a great supporter of the Cornea Project too. Please go ahead, Dr. Kazi.
Yeah, I wanted to, whatever I needed to say about the Cornea Project has been already said by our esteemed members and donors, but I would want to emphasize that this is the only project like this in the whole world. There's no other project in Africa, in South America, in Eastern Asia, where an organization, a group of people have said that blindness, preventable blindness from corneal disease should be treated regardless of access to donor tissue. And so we'll provide the resources for that and help a child, an adult who otherwise can't work, return to school or return to the workforce to support themselves and their families. So I really commend APPNA for taking this on, and Zafar and Mir Foundation for taking this on, and the long-standing support in that regard. And of course, all the other projects are worthwhile. So I'm a regular donor for the Cornea Project, so that I'll keep between myself and Fawad. But for the other projects, which I appreciate Dr. Zafar Saima advocating on behalf of her committee to the board to say, treating children and their families at a critical stage when they require emergent care is an important ad that APPNA can provide in Pakistan through Child Life Foundation. And the board, of course, was convinced based upon the commitments of the SWDRC and our APPNA donors to support this project. So $1,000 from for the for the ER project, and continued support for the Cornea Project, and $1,000 for the water well project on my behalf.
Thank you, Dr. Mushtaba Kazi. Really appreciate it. I'm so grateful for the support of our board members, Dr. Kazi, Dr. Habib Chatani, Dr. Zishan, Dr. Aslam. All of them are great supporters, and so grateful to you. Thank you so much.
Thank you, Dr. Kazi Saab. Bahut shukriya. And Dr. Naeem has also joined the meeting back. If you could please unmute him.
Ji, Dr. Naeem, welcome to our telethon.
Assalamu alaikum, ma'am. Can you hear me?
Yes, Dr. Naeem, we can hear you.
I would just like to say that I would be donating $8,000 for the pediatric ER project, please.
Thank you so much, Dr.
Mashallah.
Naeem. $8,000,
Mashallah.
mashallah is great. That is $16,000 now because we are matching that dollar for dollar. So your donation is tremendously appreciated. And, Dr. Naeem is a great supporter of the Cornea Project as well. He's not an APPNA member, but we would really request him and beg him to become an APPNA member because he's been such a great silent supporter, and really grateful to you. Thank you so much.
Mashallah, Dr. Saab has been helping us for many years. He doesn't want his name anywhere. He's very low-key, very generous, and we are very grateful to you, Dr. Saab. Bahut shukriya.
Thank you very much, sir.
Thank you so much. Thank you very much. Ji, Dr. Arifa Malik, thank you so much for joining.
It's a pleasure to join, and inshallah, I will be donating towards ER project too, 5,000 to start with, and as it moves forward, we'll take care of more, inshallah.
Thank you so much, Dr. Malik. Dr. Malik is a member of our Social Welfare Committee. She is an absolute joy, and we've really enjoyed. We were recently on a trip together for APPNA and really enjoyed her company too. Thank you so much, Dr. Malik. Really appreciate it. Your 5,000 now become 10,000 because of the matching donation. So it's really making a difference for us. Thank you.
Perfect.
Sam, I have an unknown donor who doesn't want to give the name. So 2,500 for cornea, 2,500 for child, our ER.
Thank you so much. So from an anonymous donor, we have 2,500 for the cornea project and 2,500 for child life. So that 2,500 will become 5,000, inshallah. That's wonderful. So our matching donations are continuing to come up and add on to the donations that are coming in. Thank you, Dr. Rao. Please, extend our gratitude to the donor. Thank you.
I will.
Dr. Sajid Chaudhry, would you like to say something about our projects?
Yes, Assalamu alaikum, Saima. Thank you very much for giving me the opportunity. All the SWDRC projects are very near and dear to me, and fortunately, I've been I have witnessed all these projects: cornea transplant project, water well project, from the very beginning when this was started, and as well as thank you very much for taking the leadership for Child Life Foundation ER project.
Can we mute Dr. Arfa Malik's mic, please? Yeah, there we go.
I have done.
Yeah, please go ahead. Please go ahead.
So I would like to share with our membership that Child Life Foundation has been working in Pakistan for the last many, many years, providing quality healthcare, urgent healthcare, emergency healthcare to the pediatric population. And as many of our members, they are already donor for the Child Life Foundation and have witnessed firsthand their performance. So in 2024, that's the time when we talked about this project, building a self-sustaining ER in Rawalpindi area with the help of, in collaboration with the Child Life Foundation. It was the progress, the workup was in progress, and eventually I really appreciate Dr. Baba Rao and yourself taking the lead and taking up this project this year. And it's going to be a pilot project, first of its kind in the Pakistan, in collaboration with the APPNA and Child Life Foundation in the private sector, where it will provide free healthcare, quality healthcare to the deserving population, as well as it will be charging according to the income scale of the people who can afford it, to make it self-sustaining after 2 years. Once it works out well, probably, hopefully, we'll be able to replicate that model in the rest of the cities of the country. And maybe in the future, maybe in the coming decades, that we will be able to establish this kind of self-sustaining ER throughout the country. So I really appreciate all the SWDRC members, Dr. Wais Masood, Dr. Baba Rao, Dr. Saima Zafar, and our esteemed donors, RMC alumni, Dr. Shaila Ali, Zafar Mir Foundation. And I encourage all our membership to come up and have have participation in the form of bricks, as many as from their family, friends, they can do so. I would like to donate 5,000 from my family for the Child Life ER Foundation. And really appreciate our members, Dr. Fawaz Zafar, who has single-handedly taken the cornea transplant project and really passionate, and it's more than, I think, his professional work. He spent time on this project, and the spread. I still remember we started as pilot project in 4 cities of the Pakistan, and now, mashallah, it has spread to 41 hospitals in different areas of Pakistan, and crossed 10,000 cornea transplant. It's an ongoing project, and they received good support from our membership also. Dr. Majid has been working diligently, passionately on the clean water project. And I remember when he started this project with the help of Liaquat alumni initially, and then brought to APPNA, and then ongoing. And again, this is a single-handedly the one person who is passionately working on it and taking along the rest of the membership. I'm really proud of APPNA, SWDRC, APPNA membership, doing philanthropic work for like 30 plus years. And inshallah, it will keep on going, continuing. Thank you very much.
Thank you very much, Dr. Sajid Chaudhry. Thank you for your donation. Your 5,000 has gone to 10,000 for us. We're so excited to jump on matching every fund that comes in. So thank you so much. And I have to say, Dr. Sajid Chaudhry has been a great supporter, both for Aisha, my sister. She always consulted him and got advice from him. And now I've started, bugging him, whether he's on vacation or not. I'm always asking him for advice, and he's been a great advisor to us. So and also a member of our committee. So thank you so much, Dr. Sajid Chaudhry, for all your kind support and advice. I think Dr. Tala Siddiqui had raised his hands. Dr. Siddiqui,
Yes.
would you like to say something?
Yeah, can you hear me?
Yes, we can.
Okay, so I would like to thank you so much for doing this for the welfare in Pakistan, and I would like to donate $1,000 to the Cornell Project and $1,000 to the Child Life Project. Thank you so much for doing all this for us.
Thank you, Dr. Tala Siddiqui. Inshallah, the Child Life, we will be doubling the $1,000 to $2,000 with the matching donations. We really appreciate your donation and your participation in our telethon. Thank you so much.
Saima, family will do 3,000, my daughter, son, and wife for Child Life.
Thank you so much, Dr. Rao.
I
Appreciate
just
that.
want to let you know that Babar already had donated. I won't say the money, but very handsome money through Rimkhana for this ER project. Thanks, Babar.
Thank you.
Can I just interject? My son Faraz would like to donate as well. He just started his dermatology job and has been helping with the cornea project as well.
Assalamu alaikum, Puppy Sama. I'm going to be donating 5,000 inshallah to the Child Life Project as well.
Thank you so much, Faraz. Thank you. Really appreciate it. We'll match it from the matching funds that we have. So your 5,000 will go to 10,000. Really appreciate it, Faraz. God bless you, beta.
Bahut shukriya, inshallah.
Thank you. So we've had an amazing round of donors. So we have some of our donors are on the telethon. They would like to remain anonymous, and they've messaged to me, and I will add that on, and also add the matching funds to that. So I really appreciate. This is a great effort to come in Ramzan, especially on a Sunday afternoon, and to come in a fundraising, because I know there's fundraising events at every corner right now. But for us, this means a lot. It means that we are going to see children's lives changed. I worked in pediatrics for about 3 days, and I couldn't last more because I saw children die in my hands because we did not have quality care. We did not have quality education or quality algorithms and facilities. And this was a government hospital. And so ever since then, I'm so traumatized about the fact that if I see if I see a child sick, I always have that flashback. And this project came to me on a very personal level, because if I can save children's lives, through this, they are our future. And, I have 2 granddaughters, and I always think about that this can make a difference for one family, because they are our life to us, they are our joy to us. And so are they for other people as well. So thank you very much for all the contributions, and please talk to your friends and families. And if I can have any more donors, come on our platform or on our telethon and donate, I would really be grateful. I know Dr. Atia has done a great job from, we see some rising stars in our organization. Dr. Atia from RMC has truly been a rising star, to pursue the pledges and to collect the pledges and then to get them sent. I think this is probably the shortest time that I've seen in APPNA. I've been in APPNA for about more than 20 years now. And this is the shortest period of time that somebody has been able to collect the pledges and make a promise of sending them. So inshallah, we will be sending the initial funds to Child Life Foundation to get the project started. And our hope is that by the end of this year, the ER will be up and running, and we'll have APPNA's name on it, and the bricks will be over there with the nameplates in brass to be placed on the wall. So when you visit Pakistan, you're able to see your loved ones' names, your names on those bricks. And it's a great matter, a great feeling to be proud of the fact that you have made a difference through that in somebody's life. So.
And Saima, if you let me talk for a minute, continuing on the theme, it's really, we obviously, when we go to conventions, we have a great social gathering, then we have music and we have education and all that. But APPNA really started initially for this kind of things. So which, Aisha and a lot of other people have done it brilliantly in the past. So I'm happy that we are continuing, and we have a great team between my BOD, who really were very eager to approve this project, most of them. So this child life one, so I'm happy that they finally approved. And including our committee, there's like about 300 people who work on volunteer basis whole day to make things better for other people. So I want to thank all of APPNA, including especially my teams and BOD. Thank you.
Gee, thank you so much. I really appreciate that. And, without Dr. Baba Rao's support, I mean, anytime I step away to do something else, I get a call from him and, I get going again. So, you can't succeed if your leader is not following up. And he has really been very inspiring. I also wanted to mention on this meeting that one of our APPNA members, Dr. Faika Qureshi, she was a senior member of King Edward Alumni as well. And she tragically passed away about 2 months ago. She was a very, very big supporter of Child Life Foundation and actually did Child Life Foundation fundraisers in Virginia. Her friends would like to dedicate their donations in her memory to Child Life Foundation. And what they all are wanting to do is use their donor advisory fund from Fidelity to make that donation to APPNA for the Child Life Foundation. So I also wanted to mention that if you have any senior, family members, friends who have their money in the Fidelity Donor Advisory Fund, that they can make a donation through that as well, because that will directly come to APPNA, and it can be something that is another path of donation since they're already donating their money through that. So we have those donors as well, and inshallah we'll be matching with them.
Saima, on our group, one of the very senior Canadian physician posted, डाउ के हैं डॉक्टर अरशद सईद, जब हम ये ब्रिक्स के लिए फंड रेज कर रहे थे, ही सेड के शिकवा जुल्मत शब से तो कहीं बेहतर था अपने हिस्से की कोई ब्रिक लगाते जाते। तो दैट्स द मैसेज कि एक ब्रिक लगा दें, अपना हिस्सा डालते जाएं। इट्स सच अ ग्रेट कॉज। whoever is listening and whoever is going to listen, please donate, even if you can, one brick. Thank you.
Thank you, Dr. Fizar Rafiq. और डॉक्टर फिजा रफीक हमारी लीडिंग बोर्ड मेंबर है, वन एंड ओनली फीमेल बोर्ड मेंबर, और आज इंटरनेशनल वुमेन्स डे के ऊपर शी इज in every project, like child life का project है, pantry का, every one of those projects, she is on it, and she's mashallah so organized. Really proud to have her in our board.
डॉक्टर फिजा और उनके हस्बैंड ने, जाहिद साहब ने हमें बड़ी हेल्प की है MDI इंटरनेशनल से. They've sent us funds and they want the corneas to go to every province. We've already started that project. This was the biggest donation we've had from Canada through MDI, जिसमें Zahid Saab और Dr. Saba जो हैं, they've been very helpful. Thank you so much.
Thank you, Ji. So, we are so looking forward that this emergency room comes up with the name of APPNA on top of it, and, having our own, when our members go to Pakistan, if they can visit it, they will be so proud of the way it's run and say that, our organization actually built this structure and, became the backbone for this. And not just the organization, but the organization and its children, its family members, dedicated to their parents, dedicated to their siblings. It gives a great feeling of warmth and satisfaction when we see that something like that has been done for us and it's actually visible to us. Normally it's more in a part of something, but now this will be a whole part of it. So Thank you very much for that. And the matching donations are helping a lot. I'm so grateful to Dr. Shala Ali. She has been a true inspiration for me. I'm so glad that I found her, and she has always supported and encouraged me with our project. So I'm so glad we were able to bring her into APPNA as well. Embracing such members in our organization, increases the lifespan of the organization many folds. So thank you all. I really appreciate it. We will do a running tally, and we will post that. Do we have any update from the folks who are keeping a number on the donations? Dr. Jawad and Noman, if you can give us an idea.
Yeah, so if we add all these like dollar to dollar match and everything, I think it's now 621,000, 100K, 62100.
$621,000 for
Yeah.
child life. That's wonderful, mashallah. Thank you so much. And then can you give us an update on the cornea too? And the water gun.
So, Mina, while he's doing that, I will request everybody who likes what APPNA is doing and what I'm doing should donate $5 right now. And everybody who doesn't like what I'm doing, they should donate $10 right now.
Yeah. So Dr. Rao has a very adventurous practice. He's in New York for 2 weeks and he's in California for 2 weeks. And I admire him, for his resilience, because leading a practice like that is truly a hero's job. You can't do that otherwise.
That's my question. How does he practice and lead APPNA at the same time? How can one do that?
I just continue to work day and night. Day and night.
He's truly workaholic.
Yeah. I'm sure he's working when he's in the plane as well. I was texting him and he said, I'm in the
Yes,
flight.
I was in the plane, yeah.
Yeah. But
Well,
we're so fortunate. Nobody realizes it, but they don't realize we are all volunteers. We are all giving precious time. We never charge all our trips, travels, everything we pay from our pocket. And I think one of the most difficult financial years as far as expenses is concerned for an APPNA president is the year that they're the president. But at the same time, it's very satisfying to serve our community, to serve our membership. And people may say that we spend on music and stuff, but when outside APPNA you spend it on it as well. APPNA is not providing it free, and with all these donations that we make, it's I would like it to be more visible to the people around us that we do a great deal of work, and we also financially support these projects. So it's a tremendous effort, connecting, doing due diligence. I've seen every single member who does these projects sacrifice so much of their time. I called Dr. Majid once, and he was in some far-off area in Tharparkar trying to work on a water well while he was on a trip to Pakistan. So tremendous sacrifices, hard work, and passion from our members.
I think Dr. Majid's hand is on if somebody can turn him on.
Dr. Nigar Karmani is here. Dr. Karmani, if you can say a few words, please, for the Child Life Foundation. I know she wanted to say. Can you unmute her, Noman? Dr. Nigar Karmani.
Yeah, once. Yeah.
Ji Nigar Appa.
Can you hear me?
Ji, we can.
Acha. So I wanted to make a plug for the Child Life Foundation because my classmate and best friend, Faika Noor Khan Qureshi, who tragically just died in December in a car accident. She had worked in the pediatric ER all her life. She was director of the pediatric ER in Norfolk, Virginia. and she was raising money to expand these pediatric ERs in Pakistan. So in her honor, I would like to pledge $10,000 to APPNA Child Life.
10.
Thank you so much, Nigarappa. And Nigarappa, we are going to inshallah match the 10,000 with $10,000. So that inshallah will be increased to $20,000. So thank you so much for doing that. Really, really appreciate it.
Okay, great. Thank you very much.
Thank you. Thanks a lot. So team, give us an update on all the funds.
So like we're trying to calculate one match, so it's become like a little bit difficult to calculate all of them. But overall, like we have exceeded like 640 overall in all of the projects. So most
In all
of
the
them
projects.
are for child life, and then bricks a lot of for that. But I can like update you on the total number of bricks separately and everything after calculating. It's going to take some time, I guess.
Okay, but we're above $640,000 for
Yes.
all of the projects.
Yes.
That's wonderful. Thank you so much. Thank you, Dr. Jawad, for doing this, and thank you, Numan, for trying to balance our conversations and hosting the event.
Yeah,
Thank
no
you.
worries. Thank you.
Anybody else have any questions or comments?
I think Dr. Majid has his hand up. Noman, can you unmute him? Dr. Majid,
Yeah.
Abdul Majid?
Yeah, I have already unmuted him.
Oh, okay. All right then.
So, inshallah, this has been a great telethon, and I'm so happy. My hope was that we would get above 500,000, and we've definitely achieved that. The remaining amount that we have, we will inshallah be constantly asking friends, families, our children, our children's friends, our friends' friends. I have several of my non-APPNA member friends, whether an engineer or an IT, specialist, who have donated bricks to the project. And inshallah, by the summer meeting, my hope and goal, and inshallah, my prayer is that by the summer meeting, we will have completed our $1 million, fundraising for the project, and we will inshallah see this up and running by December. So thank you to each one of the participants. Thank you to our committee members. Thanks to our board members who have participated in this project. And I think at this point, I would like to have Dr. Babarao make some concluding remarks.
No, I just want to, it's already a long day for everybody, but thank you, everybody. And from the bottom of my heart, as I was saying the other day, somewhere in Naftari, I seriously believe we all have a purpose, and you all are doing your purpose very well. So thank you very much.
Thank you, Ji. Jazakallah, and may Allah accept everybody's donations, everybody's charity, and inshallah make our project successful. Thank you, Ji.
Thank you.
Thank you so much. Hello?
Hello.
Hey, I just got a message from Aisha Nawab. She would like to donate $1,000 of child life in memory of Dr. and Mrs. Nawab Khan. Hello?
Yes, Dr. Zafar, we added her already. She messaged in the chat box as well.
Okay, and did you have the message from Noor Khan Sab as well, $500?
Yes, we have that.
Okay, thanks, sir. Bahut meharbani.